Really, the goal is just to use our stories to bring veterinary medicine to life for the pet caretakers of the world. And we're doing it because we believe that educating these caretakers is the most powerful thing that we can do to improve the life quality of all of the pets that we love. Hello, everybody. This is Dr. Natalie Brackeen.
Dr. Josiah Dame.
And this is Vet Tales. Mm-hmm. We're back.
We are back.
Live and in action. Here we go.
Fun one today.
It is a fun one. I don't know how, sometimes these topics, like we were just talking about, like how did they escape the radar for this long?
Yeah.
I don't even know. Honestly, I don't even know how we got to where it was at the top of the list today. But I'm actually really excited about it. I've had a few cases, good, bad, and otherwise.
At the bottom of the animal, but the top of our list.
That's how I was thinking about this earlier. I was like, how many puns can we come up with in this? We're going to see. So yeah,
a lot. From
the bottom of the animal to the top of the list, our talking point today is anal glands. They just stink. Anal glands stink. They're just a pain in the rear.
Pain in the bottom. And the question is...
there just seems to be no end to it, really.
And then, why do we still have them?
Okay. But actually, evolutionary-wise, let's just... not that I'm into evolution, but you know what I mean? For the survival of the species, let's just do it. Let's talk about the whole thing. First of all, what is an anal gland? Anal sac, as we call them otherwise.
Go for it, Natalie.
Okay. So they're little sacs, right? Little glands, scent glands, that are at the 4 o'clock and 8 o'clock on the dog's booty hole, if you will. But they're just right inside the rectum, in between the muscular layers, and they have these little tiny pores that allow liquid to escape them. They smell horrific because their primary function was scent marking.
While pooping.
So
when a poop comes out, they squeeze out.
It's supposed to squish out the liquidy stuff. They can also be immediately evacuated rapidly with fear or stress. So think skunk.
Like little skunks.
Which
those are...
They're anal glands.
Modified anal glands.
Yeah.
Is what the skunk is.
That's right. And it's chewy. And it is no different in dogs and cats. They are very smelly secretions from the anal glands, even in the most normal of creatures. And
how I would describe an anal gland smell is fishy poop.
Fishy poop, yeah.
It's like
it's musty,
just musty, fishy, poopy. Everyone is like, we're sitting next to Fluffy, and then all of a sudden I smell like fishiness, and
but not good fishiness.
Yeah,
forgot to empty out the cooler fishiness. You know,
like a rancid fish.
Yeah,
and then usually people bring them in for anal gland expressions.
Yeah, which can be somewhat routine.
Yeah, can be routine. A lot of people with smaller breed dogs I would say smaller breed dogs tend to have a tougher time expressing them.
Yes.
Than a larger breed dog.
Yeah.
And then so those people that have dogs that struggle with anal glands routinely come every 8 weeks, sometimes every 2 to 3 months to get the anal gland squeezed.
Right.
Or if they start to notice the dog's acting like their butt's being pinched.
Yes. Yeah.
That can be painful.
Okay. So first of all, let's talk about what is anal gland expression, and then let's talk about when do we do it.
Yeah. So anal gland expression there's two types. There's an external expression and an internal expression. At Northside, we only do internal expression. Very commonly at grooming facilities, they're going to do, we do internal.
Yes.
They do external.
That's what you said.
Okay,
yeah.
Good.
Yeah.
So the external is where you actually just go from outside, you're touching the fur of the dog, and you are grabbing the anal glands,
booty,
their little bottom,
their rectum, yeah.
You're squeezing at the base of the anal sacs, which if you can imagine are little balloons.
Yes, there are. There's little balloons with the end of the balloon kind of pointing towards the rectum.
Yes. And so you grab at the base of the balloon, so the round part, and you squeeze towards the little opening of the balloon to express out the anal.
Yeah. I don't know if this is helpful at all, but it's a similar concept to milking a cow, even. So you're just taking the top of a gland and squishing it towards the pore that's open.
Removing the gross stuff.
I'm really, really happy for anybody who's still hanging with us through this. It's wildly disgusting. topic.
So that's external expression. So from the fur on the outside, you're just which you don't always get it all.
Listen, when we had grooming here, like we had our groomers do internal because you can't tell how much is in there.
Yeah.
You can't tell if you've gotten it all, if the anal gland is deep or low or whatever.
There's some that are
hard, or if they're already getting kind of like disease where the secretions aren't thin and it's difficult to get out, you're never going to get it from an external expression. So internal is a more thorough approach.
And you can usually milk out more essentially with the internal. So internal, you put a glove on,
please
wear your glove. We lubricate, and then we go in, and then we
with one finger,
and then we express it. One finger on the outside, one finger around inside,
and you're just kind of pinching the anal gland between your fingers,
pulling it.
Yeah,
and so that's what we're doing to the dogs.
You can do this at home. We will teach you.
Yeah, you can. Most people are like, no,
thank you.
Let me pay the $12
Yeah,
every couple
I
months.
could absolutely learn how to change the oil in my car. Not gonna.
Not going to.
Not gonna.
So, I feel like we tend to do these, like I was saying, in small breed dogs that aren't good at expressing them themselves.
Mm-hmm.
And usually we find out that they're not good at it when we get into here's the thing that this dog or cat has. Oh, they're presenting for a problem for it.
Yeah. What's wild is, so when I first started doing veterinary medicine, graduated vet school, my very first week of vet school that I was on, or my first week being in practice where I had emergency shifts, I had one of my very first emergencies was a dog that wasn't jumping up, was kind of walking around weird, had its tail tucked down, seemed really sad, just like wasn't eating great, hadn't been outside of the bathroom. His anal glands. Anal glands were just like, they were huge.
Yeah.
And so we expressed the anal glands, and the dog started wagging his tail again and jumping.
Normal.
And we gave it anti-inflammatories, and it's great. But what are other symptoms besides the tail tucking, acting weird?
Tail tucking, acting weird, walking along, and then all of a sudden, like, they act like their butt got stung by a bee, and they'll sit down.
Yes.
And along with that, you might see butt scooting.
Yeah.
Butt licking.
Mm-hmm.
That's kind of like the full
the dragging, the dragging on the ground. But yeah, that acute like plop your.
Oh.
It's almost like what's that game kids play, red light, green light, and it's like red light, boom,
and then they sit really quickly.
Yes,
because their butt hurts. So that's like the impaction or a full anal gland, and then when you get really extreme, you can actually get openings.
Yeah, like I was saying, like I've had busted or ruptured anal gland. We call them ruptured.
Yeah.
The other day we had a client, I mean, this is what I think brought it to the front of my mind, was the dog had the anal gland liquid should be very liquidy, if you will. Sometimes it's grainier, sometimes it's pastier, but this was like that clay that you like can mold with. I could not get it all out. And one of them had already ruptured.
Yeah, the best way I describe it to people with the clay is the fireworks snakes.
Yes, the snakes.
That's what it looks like.
Charcoal snakes.
It's gross.
Yeah, when you actually get it to come out, it looks like a charcoal snake. Sometimes it's black like that. Sometimes it's green.
Yeah, and sometimes it's thin, and because you're squeezing it, sometimes you can get a little bit of blood, and it's usually not that big of a deal. But we watch the material very closely.
I have one patient, and his name is Ace, and this dog he's a Maltese, and he's probably 7 now. And for the past 5 years, his anal glands have been the color of bright green snot.
Mm-hmm.
There is nothing I can do to change it.
Mm-hmm.
He just has this coloration, and that's just him. But for the most part, like the first few times, I thought it was infection.
Yeah, you just have to keep an eye on it.
Yeah, because a lot of times so we'll have, so you have a normal anal gland, then you have an impacted anal gland, and then you can have an anal gland inflammation, which may or may not have infection. Then you can have an abscess that ruptures, and that'll just look like a hole on the outside of the dog's booty.
Literal hole.
Like right at the 4 o'clock or at the 8 o'clock. It's just a hole. Like they've been shot with a BB gun.
And the anal sac contents will come out of it.
They do absolutely come out of it, and blood.
Yeah.
And it's very terrifying. And they heal I feel like a hero sometimes.
They heal really
It's crazy how fast they heal. You can just express the icky bits, you give them antibiotics, anti-inflammatories, and boom, we're back in business.
Sometimes it just feels like they're meant to rupture.
Yes. You're like, this is just part of the molting process.
I've told owners before, I'm like, honestly, be glad that it has already ruptured.
Yes.
Because it's done
because
half the job.
This poor dog that I saw with the one that had blown out, the other one was totally just fully impacted, and it was all I could do to express half of it. And I was like, oh no, I think this one's going to blow too.
Yeah.
So anyway, we'll see.
And
just see you back in a few days.
Chronic disease, which you have here allergies, because when you have a dog with chronic anal sacculitis, there can be a food or environmental allergy that's triggering some of that.
Yeah.
But you can also just have chronic infection and then cancer. You can get cancer of the anal sac.
Oh gosh, this is the worst. Unfortunately, one of my favorite patients, his mom's probably listening now, but anyway, just got diagnosed with anal gland adenocarcinoma last week.
Which I call Agasaka.
I mean, you and many others. Agasaka, it's fun to say.
Not fun to find.
Not fun to find.
It is really annoying, actually. And a lot of times, because, we do anal sac expressions when we're doing like exams and stuff, but technicians are doing a lot of the times. Our techs and assistants are really good about being like, I felt something weird. And this dog that's here for just a technician, anal slap expression. And then we are like, okay, we glove up and go feel. And then we're like, oh no.
Yeah. Yeah. And this guy, he was having some straining to defecate and a bit of loose stools with the blood.
Yeah.
And so that's kind of where we started looking. And then it was just like, oh no.
Mm-hmm.
But yeah, straining to defecate is one of the most common symptoms with the Agasaka dogs with the carcinoma, anal gland carcinoma, because of the anal gland isn't actually all that painful to them. It's just big.
Yep.
And so instead of having these little tiny balloons that should be like the size of a blueberry, they're like the size of a dinner grape or a walnut, depending on the size of the dog. And it's just a physical impediment of normal poop traffic area. And so that was one of the triggers for him, which honestly, I think
Ribboning poops.
Yeah, ribboning poops. Yeah. But also I was like, maybe it's his prostate. So I think I may have been originally like, is it his prostate? But the blood in the stool is something. But dogs get blood in their stool all the time for lots of reasons, just stress colitis or whatever. So let's back up just a wee bit into treatment then for each of these things. So we've talked about, we've got the impactions, the inflammations, the infections, the abscesses, and then the cancers eventually. And so if we go back to the beginning and we start walking through treatment, let's just say you're a small breed dog that just is like a 7-year-old Maltese that has just booty scooting issues.
Yeah.
Treatment plan is just routine
expression. I usually try to get people on a 2-month rotation.
Yeah.
Because I don't want them to do it too often, because then we're just irritating the bottom.
Yes.
And then we also may do a supplement like a no scoot chew, which is just a fiber supplement.
Yeah, which I also like to do beyond the no scoot chews, because those are great. They're like a hodgepodge of different ways to get fiber in there. But I also do ground flaxseed and or pumpkin, depending on the dog's stool. Because again, like the ideal situation is the dog's stool is bulky enough and solid enough that it expresses the anal glands manually on each bowel movement. Yeah.
Yep.
So dogs with chronic diarrhea, are going to have more issues with their anal glands. You've got bigger issues than their anal glands. So. But canned pumpkin would be more helpful. But if we have a really, I guess, honestly though, even like the hard dry stools that are too small because they're too dry, canned pumpkin works great. So
it works in both ways.
Yeah. So, and they do have, like Dr. Dame was saying, some over-the-counter chews.
And then for the sacculitis, so the inflammation, potential infection with, pus and blood, you could do a couple things. You could use, obviously you'd express the contents that there, and then you have to deal with the inflammation infection. So a lot of times we do a non-steroidal anti-inflammatory. We may do an oral antibiotic, which there's a whole kind of list of options there. And then occasionally we will put like a medication inside of the anal sac.
Yeah, it's interesting because it's like this is so gross to say it out loud and I'm thinking about it, but it's the same thing you put in like teeth abscesses. And it's got this little tiny applicator tip and you just zoop
and then just throw it in there and just fill it with the local antibiotic. And it actually works way better sometimes than the oral.
Yeah.
You do have to weigh the odds sometimes of how bad it is. Sedation. Can you do it awake? Which is hard. Is it even worth, depending on how bad the anal sacculitis is? And so it really just comes down to the patient.
Yeah. Well, it's like the first time you're like, okay, yeah, let's just do something simple. Yeah. And then the second time you're like, okay, maybe it was something a little more complicated. And also, did we deal with underlying issues like food allergies or whatever? And then once you start getting into chronic and recurrent, you start blending the treatment plan of chronic anal sacculitis with the Agasaka, which is anal sacculectomy or removal of anal glands.
Yeah. And then like we talked about with the abscess, it's already done half the work for us. So a lot of times you don't do the topical with that one. You'll just do the orals. And then that
if it's ruptured, you mean?
Yeah. And then the chronicity and the cancer is when you start to talk about removal.
Yeah.
Which Dr. Trussell
I know. He does. He loves it so much. He's like, oh, thank you so much for that surgery.
Why doesn't he love them?
They're hard. I mean, it's positionally it's difficult. It's a very detailed, sensitive area. They report things like, potentially risking nerve damage of the rectum, which could cause incontinence in the dog. Knock on wood, I have been working with Dr. Trussell side by side for 15 years now, and I've never seen one. Never seen him have any kind of nerve deficit. But
I haven't either.
Even in the carcinomas, I just haven't seen it yet, but it is reported, so we go into it aware that it could happen. But it's a lot of pressure.
Yeah, I always warn people.
Yeah, you warn them just in case.
A large carcinoma.
Yeah, and we don't. Yeah, so we don't just jump into those willy nilly. Like never ever would I say like to the 7-year-old Maltese again when they're like, "I'm so tired of coming in every 2 months. This is exhausting. Can we just remove these?" No. No. But you can learn how to do them at home or have your groomer try every other time or something like that. But if we're getting into abscesses, infection, disease, absolutely. And then with cancer, absolutely. You've got to get them out because those dogs will it will spread.
Yeah.
I'm sure.
And then with the cancer we talked about, we find it on a physical exam a lot of times because they're coming in for straining and bloody stool and, or sometimes our technicians catch them when because our technicians have been able to find like really small tumors.
Yeah. Well, I mean, they do this all day long. Yeah. So they know normal and what isn't.
Which is so nice. And we'll catch them too. But, also with Agasaka, you will get a lab work change too, like elevated calcium, which I have seen before in Agasaka. And so we'll just be doing routine lab work and sometimes can...
Yeah, there are other cancers that cause elevated calcium in the blood. But when you see elevated calcium in the blood, the first cancer you check for is anal gland adenocarcinoma. Yes. Yeah. And then we do MET checks too. So like if we find out that they've got the anal gland carcinoma or suspect it, based off physical exam, we'll do abdominal ultrasound and chest films to look for metastasis because it does spread mostly to the lymph nodes in the region. But yeah.
And then referral for chemotherapy at that point. We have a patient that got an anal sacculectomy diagnosis and then was referred for oncology. And
which patient are you talking about?
I'm talking about
Comet or which one?
Different one.
Okay, because that's what I was going to say. Comet was the one that I had sent, but that's been several years ago now.
Dachshund.
Oh, yes. Okay, I recall. So, it's unfortunately not a rare cancer.
No.
In retrospect, all the dogs I've diagnosed with it were pretty good sized.
Yeah, I think they grow pretty rapidly because I've had one that
I meant the dog itself.
Oh, the dogs.
Yeah.
All of mine have been small.
Interesting. Okay.
Yeah.
So it's just luck of the draw.
Yeah, I think so.
All
but
right.
like the ones that I have seen the tumors grow quickly though.
They do. The one that we just took out last week, it didn't protrude that far. It was kind of like wasn't nice and round. It was more like an oval. And I bet you that thing was close to 4 inches long, which is, 75% bigger than it should be or whatever. It should be like an inch long.
Yeah.
300%? How does that work? Somebody else do math.
That would hurt my brain.
Yeah, we need Dr. Trussell for that. Statistics, percentages is also easy to manipulate. So, but anyway, so that's the anal gland thing. And like we talked about, cats do get impacted anal glands. I've never seen a cat anal gland carcinoma
yet.
I've seen some infections. I have seen a couple of ruptures, but it's much less common in our kitty cats.
Yep. They're better at expressing than the dog.
And also you can do externals on them way easier because of where the pore
is too.
Yeah. And the pore for the anal gland is more external.
Yeah, you could see it.
Yeah.
Way more readily.
Like when you look at their little booty, you can see a lot of times a little spot that's dark when you're like, oh, your anal glands are full.
Yeah.
And that's a good telltale.
It's gross.
Tail.
And then preventing. So what our clients can do to kind of prevent this as a huge problem for them later in life, because I do feel like dogs can go 3 to 4 years before they even start to need an anal gland expression.
Oh, yeah.
Healthy weight.
Absolutely.
That matters because of posturing, because you want the dog to be able to posture in the cat.
In the vertical position.
So that they can actually squeeze correctly to hopefully express them. Fiber supplements can help. So make sure that they have normal stool. So if they're chronic loose stool, that's an issue. Allergies, like we talked about, food or environment can lead to anal gland itchiness and then issues. And then avoid actually overdoing it, like of the expression.
Yeah. Because that does cause chronic irritation. And I always tell clients when they've had an animal with a really full anal gland and we express them, I always send them on anti-inflammatories and say it's going to take a couple of days for these anal glands to settle down at this point because they're just
angry.
Yeah, I mean it's similar to if you had a zit or something, you know what I mean? There's angry tissue around there and it's got to take time to heal, even if it's
Also mechanically squeezing it is just
physically traumatic. Yeah. And then I guess if I were going to think about anything else as far as in case people are like, what if my dog has allergies? A lot of these dogs, they do have a very itchy booty, so they'll scoot and drag, but they often will have concurrent symptoms of itchy ears, licking their feet. Those are probably the most common. Or you can have other GI disturbances. Most of the time, dogs with food allergies manifest as dermatitis.
Yeah.
But occasionally you can get them manifesting as, depending on the type of sensitivity we're talking about, with vomiting or diarrhea, that kind of thing too. So those can also be reasons to suspect that your dog has an underlying allergy issue and not just a primary anal gland issue.
Yep.
So anyway, so that's the end.
We got to the end of it.
We did. I feel like I've really expressed myself.
Yeah.
Yeah, it just came to me. I feel pretty good about that. All right, cool. So if you ever have any issues or if you ever want to learn how to just express your animal's anal glands on your own, just, ask us or your veterinarian if we're not your veterinarian. And hopefully it's not a problem for you because they stink.
Yeah, it do.
So. Okay, well, until next time, we'll see, as always, whatever topics you guys think of that you have questions about, give us a shout and we'll be happy to talk about it.
All right. Bye, guys.
Bye.